Kim, you've been attending the last two ECCMIDs and the first ESCMID Global. What got you excited most being there amongst clinicians as a basic scientist?
Yeah, these have been 3 great years and great experiences for me. As you know, I'm a basic scientist. We do fundamental research, and I have found these experiences at ESCMID to be really important for the development of our research. We do clinically relevant research, but we don't often get to interact with clinicians. And so at these meetings, we present our work, we get feedback from clinicians, we see the big picture, we know what the important questions are that clinicians are thinking about that we may or may not be thinking about. So it really drives the development and sort of progression of our science. It's also been fantastic for networking. I have built countless relationships and collaborations with people as a consequence of these meetings. And so it's been both professionally enriching, but also personally enriching.
Great to hear. So you definitely recommend to attend also to other basic scientists?
Yeah, this is a place for basic scientists. I think it's not always on the radar for basic scientists, but it should be, because many of us are doing clinically relevant research, but don't have these opportunities. And so it's a really great opportunity to get that clinical perspective.
Thanks for that great feedback. There's one little negative feedback I sometimes hear from basic scientists, that is, they say they would never attend such a large meeting. What is your take on that?
It's true it's a big meeting, but the way that it's organized, you don't feel it. There's all of these different sessions, and the individual sessions and opportunities are much smaller, so you can interact with small groups of people, get feedback, ask questions. It feels personal. It doesn't feel impersonal in any way. So it is a big meeting, but it doesn't feel like a big meeting.
Nice.
And I have a question for you. So you have been a big advocate for including more and more fundamental science in ECCMID and ESCMID Global. Why?
I think it's extremely important to understand the pathophysiology. If you treat a patient, you have to understand the disease behind it. And so having this mix of clinical aspects as well as of basic science aspects, merging them, for me, it's the best of 2 worlds, because we get to better understand what's going on, and this will tailor treatments in the future. So I've found it has been a great enrichment, and many people were very happy about this dual aspect.
We really look forward to seeing you in Vienna at ESCMID Global in 2025.
And I can promise you, we put together some fantastic sessions combining clinical aspects as well as pathophysiology. So see you at ESCMID Global in Vienna next year.